lovely pair of earrings and said, I'll tell you what, I'm going to help you because I've got my first law exam tomorrow. He said, I'd like to write a pocket-handled copy of the Constitution. I've printed out the bloody thing. I've got 300 pages to drag into the exam. She said, well, maybe you should sign that. I've actually got my own little pocket copy of the Constitution now. Signed by Nicola and signed by the Prime Minister as well. So that will be coming into my law exam tomorrow and then being framed something and sat in the corner. So I just thought that was so touching and I wanted to thank you very much. Alright, we're going to crack on. We've got our first image here. We've got to take the shoes. Nicola Roxon was sworn in as the Commonwealth Minister for Health and Ageing, including cabinet responsibility for sport, which her staff rallied to have in her title on the 3rd December 2007. The Labor government had an ambitious health reform agenda, with more than 70 separate election commitments made in the health portfolio. A significant reform agenda for any portfolio, of particular challenge would be the Prime Minister and Health Minister's commitment to fix the hospital system once and for all. And if the state governments wouldn't play ball, the Commonwealth government would seek via a referendum to take the hospital system over. The new government's reform agenda was massive. The government was committed to establishing a National Health and Hospital Reform Commission, implementing a comprehensive primary health care strategy to fix up the interaction between doctors and allied health professionals, establishing a preventative health task force because we know that prevention is better and cheaper than cure, rolling out GP super clinics to improve access to doctors and allied health services in areas of shortage, implementing the first ever men's health policy, rolling out kitchen gardens to hundreds of primary schools across Australia, increasing the number of GP places at universities and training places in communities across Australia, funding for more breast cancer nurses through the McGrath Foundation, and then there are all the ideas that come up once you're in government. In June 2009, the National Health and Hospital Reform Commission's work was put before the Australian community. A comprehensive list of 123 recommendations aiming to fix the Australian health system was up for discussion. Then Prime Minister Nicola announced a national listening tour of Australian health facilities that would road test the Commission's work. More than 60 of these visits were personally made by Nicola. Nicola held consultations at hospitals from Cairns to Hobart, from Royal Melbourne to Royal Perth and Royal Darwin, and so many in between. And if that sounds like a busy year, in September 2009, Nicola and the Preventative Health Task Force launched Australia's Preventative Health Report, Australia, the Healthiest Community by 2020. The report made recommendations in 3 key areas Australia needs to improve: obesity, tobacco, and excessive consumption of alcohol. We'll see more shortly on how Nicola took these recommendations and sprinted off to implement. In 2010, Nicola also launched Australia's first ever primary health care strategy. When she launched the strategy, she said this: the National Primary Health Care Strategy is the first for Australia, providing a national roadmap to guide future primary health care policy and planning in Australia. It sets out key priority areas and essential building blocks that need to be in place to provide the foundation for an integrated, high-performing primary health care system fit for the future. By the end of 2010, Nicola had launched and mapped out the road ahead in 3 key areas of policy: prevention, primary care, and hospitals. The architecture was there, and the government had a clear plan for the first time in so many years. If you think that sounds like a lot of work, just like Tim Shaw with his extra set of steak knives, Nicola had more up her sleeve. At a time when the Commonwealth revenue was taking a hit during the global financial crisis, Nicola fought hard to protect and even grow the health budget. This meant some tough decisions, and even meant breaking election commitments to the private health insurance industry. But hey, that's politics. So I ML portfolio wasn't a bed of roses, but Nicola always remained focused and never got distracted by the day-to-day media cycle, something perhaps today's ministers could learn a lot from. There was the year spent trying and eventually succeeding on implementing the government's crackdown on young people consuming what's known as alcohols. The industry fought Nicola and the Labor Party every step of the way, and it wasn't humiliating to see the Liberals eventually back down and support Labor's policy. The industry threw everything at Nicola, and she beat them off, remaining focused on what was the right thing to do. Nicola also launched a full frontal attack on the tobacco industry. We got the feeling this fight was personal, but again, it was the right thing to do. On the 29th of April 2010, Nicola announced the government would introduce plain packaging on all cigarette packets in Australia. The tobacco industry and their funded mates from the Liberal Party seriously is one of the most extraordinary achievements. The tobacco industry and their funded mates in the Liberal Party said they'd try to plan every step of the way. With deep pockets on their side, Nicola stood firm and told the tobacco industry to bring it on. She also sought to highlight the hypocrisy of the Liberal Party, who still took donations from the tobacco companies. It saw Nicola coin the phrase, "keep the habit, Mr. Abbott," when calling on the Liberal Party to stop taking tobacco money. While busy getting the structure of the health system right, Nicola was also busy ushering in lasting changes in other key areas. Introducing Medicare payments for midwives and nurse practitioners, the first ever medical training facility locally at Sunshine Hospital and one coming at Werribee Hospital, GP super clinics across Australia that have treated more than 3 million people in the last few years, a network of regional cancer centres across Australia to address the shocking gap that if you diagnose with cancer in a regional town, your chances of survival are 60% less. More than 60 funded breast care nurses across Australia, hundreds of thousands of dental checks for teenagers. But without a doubt, the $750 million to fund regional cancer centres will go down as a life-changing support for cancer patients in regions. And that's literally life-changing. Never one to shy away from the debate, Nicola would probably regard this as one of the more funny moments as Health Minister. Let's have a look.
Now, I did wonder whether he would be a bit unfair on the Leader of Opposition because he was no doubt pretty busy working out what he was going to do with several thousand golf balls that he paid for. $6,000 to encourage the House to do to tell you of any worthy charity that might actually be able to do something useful with their golf balls. Because they certainly are not going to help any doctors into rural areas. And it's interesting because the man who is I'm told is a golf fan. I am prepared to offer him some balls if he wants some.
Like I said, Nicola is always focused. After 4 years and 11 days as Health Minister, Nicola was promoted by Prime Minister Julia Gillard to become Australia's first female Attorney General on the 14th of December 2011. In March 2012, Nicola would also add emergency management to her portfolio. Nicola kept the foot well and truly on the accelerator in her new portfolio. In her 14 months as the first female Attorney General, Nicola saw off the challenge from big tobacco in the High Court, appointed 2 new High Court judges, something that doesn't occur every day, set up the Royal Commission into child sex offenders, and managed the Commonwealth Government's response to disasters in Queensland, Northern New South Wales and Northern Tasmania. And at some point, now time to eat and shower. Now
So announced I not intend to contest the next election and accordingly have offered my resignation to Prime Minister as Chair and Minister for Emergency Management. And let me say right up front, Prime Minister, how much I admire what you have made our government do for Australian families, and I really appreciate it with one step in these at night. So announced I.
is there more of that? No? Probably just talk to the window. I watched that when it happened and I actually did cry. On the 2nd February 2013, Nicola announced her decision to resign from Parliament at the September election and step down as a minister in the Gillard government. When Nicola steps down as MP for Jellybrand on Monday 12 August, she will have served 5,430 days as a local MP. 1,891 of those days as Cabinet Minister. Nicola Roxon, this is just some of your political life. Nicola, so we've got some tributes for you coming up on the video now. Yeah, you probably should have.
Nicola's actually too young to have has chosen to retire on her terms. I go back many years with Nicola and made two important decisions that affected her life. One was to promote the funding where as Minister for Families, Children and Youth Affairs. She developed a policy which she subsequently was able to implement in part as the Children's Commission. But she was a great worker, great stakeholder engagement, a very effective politician and a fantastic minister both for health and for youth. The second decision though was that unbeknownst to me at the time, Michael Kerris was working in my office in Victoria. And that of course led to their marriage, it led to Rebecca, and now it leads to the planned great escapade together. So all the very best on your trip.
Back in 1998, when we were first elected to Parliament, the young women who joined the Labor team at that time were each invited to come along to the National Press Club on a Wednesday evening and they talked about themselves and what they hoped to achieve and their electorates, etc. So Nicola had her turn, we all went along and of course she knocked it out of the park. I remember chatting to a bloke who'd come up from Melbourne for the event. He was Salt the Earth Union bloke who'd been a colleague of Nicola's. And he said, you know, Nicola's such a star, but through it all, she discussed Nicola. And I've got to say, 15 years later, that is absolutely my experience. Throughout all of her huge responsibilities and incredible achievements, Nicola always had time to be a really supportive colleague and never forgot how to be a great mate. There's a huge list of things that Nicola has achieved in her parliamentary career, and I can't wait to see where that list is going to end up, because she is going to have a fantastic range of opportunities open to her, and I'm very happy to see her.
All right, so you go when you're ready.
Thank you. Hi Nicola, I'm so sorry I can't be here for your dinner, but we really want to pass on my best regards and say thank you for incredible years of service, but also for your great friendship as well. I first remember you when I became a candidate, your great generosity, giving me a call, asking me to come and have a chat to you about how you might actually help and assist in my campaigning. We were sick at the time. I had to pop into the house at Yarraville, and it was a pretty green candidate. It was a great opportunity to meet someone who might greatly to actually be able to talk through what were some of the issues that was happening. And I really do appreciate that you have mentored both me and many women throughout the course of the career. So I want to say thank you for that. I've also been asked to give a somewhat funny anecdote. You may not like this one, but I'll give it a go. I think, again, fabulous serving under you as Parliamentary Secretary, as Parliamentary Secretary for Health and Ageing when you were Minister for Health. And, again, a fantastic year of service. But my favourite anecdote was that awful experience we had when the Japanese tidal wave came and we had Fukushima, and it was obviously a fairly critical point. It happened when you were on leave, I was on leave, I think at the time as well. And we suddenly found ourselves in the health portfolio suddenly being dragged into National Security Council and National Security Council issues and radiation security and all of those things. And that you, of course, had to go and attend the National Security Council, but you've been down the beach for the weekend, and came in, thought you were doing it over a teleconference, and ended up coming into the CPO to do it in your summer gear, in your singlet, and suddenly finding yourself being into the National Security room here in Canberra, all of the Admiralty and all of the National Security Council in your beach clothes. And you say, if only you had known that you were actually going to be ending up with right in the middle of all of the Defence Force and the Prime Minister and all of that stuff, you go in your beach clothes, probably would have made a different choice. But I just do want to say, absolutely, it's been a privilege serving with you. I hope we do very much manage to keep in contact. I'm sure that we will. I know your contribution to public life is not ending here, and we look forward to what the next iteration of Nicola Roxon will
Nicola, I'm so sorry that I can't be there in person to pay tribute to you today and to your political career and to our personal journey together. But it's great to have this opportunity to say a few words about you. We've been on this journey together since all of those years together in opposition and then the years of government. And across the years of government, you've got so much to be proud of. So much to be proud of as Minister for Health, making sure that our country reformed the way in which we fund healthcare, and you and I certainly know what that took and your tenacity to get it done. And what you achieved too, challenging big tobacco, staring them down and winning through. I'm not surprised that you've been recognised globally for that work. It's a fitting tribute because it was so hard, so difficult, so opposed, but you stayed the course and you've made a big difference, not only for the health of our nation in the future, but for health right around the world, as our example of plain paper packaging is picked up. And then you went from health to being the nation's first ever female Attorney General, a fitting place for someone who worked all those years ago for Mary Gaudron. And you rose to that challenge and in a very special way shaped the Royal Commission into child sexual abuse that is going to give our nation a lasting set of learnings for the future. So Nicola, it's been a huge career and you picked the moment to go. Pick the moment when you wanted to do something different. Pick the moment when you wanted to start your next career or perhaps your next several careers. And pick the moment when you wanted to spend more time with Michael and with Rebecca. I know you're always going to look back on these years with a real sense of pride, and so you should. And I'll look forward to seeing you in Melbourne's West, no matter what the rest of the journey brings.